Well, good afternoon, class. Today we're going to be discussing the topic of intramuscular injections. We're going to be focusing particularly on how to administer a proper ventrogluteal injection. So as you guys saw in the video, this poor gentleman received patient harm from an improperly administered ventrogluteal intramuscular injection. This is why it's imperative to learn the correct and proper way to administer a ventrogluteal injection to avoid patient harm. So in today's class, you guys will be learning how to safely and correctly administer an intramuscular injection in the ventrogluteal site. The gluteal area has always been a common site selected by medical professionals for intramuscular injections because of the large size of the muscle and the large volume amount it can receive. You can administer up to 3 to 5 mLs of medication via IM injection into the buttocks, depending on the patient's size. So out of the 12 billion injections that's administered globally every year, it's estimated that 50% of intramuscular injections are administered incorrectly due to improper training. Permanent and irreversible nerve damage can be one of the unfortunate complications of an improper injection. The sciatic nerve is the most common nerve that is damaged from intramuscular injections. Sciatic nerve damage can lead to pain, muscle wasting, decreased sensation, issues with ambulation, and foot drop, as you can see in this diagram and as you saw from the YouTube video. The sciatic nerve starts from the lumbar and sacral plexus in the lower back and runs through the buttocks and into the thighs. It's responsible for delivering signals to the muscles, skin of your thighs, lower legs, and feet. Because it innervates so many key parts of the lower body, damage to this nerve can be especially crippling and impact a patient's quality of life. It is also the largest diameter nerve in the entire body, and it's at its thickest diameter when it runs through the gluteal muscle. Therefore, it makes it a very easy target to hit if an intramuscular injection is administered incorrectly. So how can we avoid sciatic nerve injury? Well, for starters, the vastus lateralis site should be considered prior to the ventrogluteal site. Also, the ventrogluteal site is contraindicated in certain populations. These populations include children, especially children that are agitated, as restraining them while they're agitated could lead to improper administration of the injection and cause damage to the sciatic nerve. It's also contraindicated in the elderly population and underweight population, as they have less muscle tissue in that area. Next, the correct needle length should be used. The correct needle length can be anywhere between 1 to 3 inches depending on patient size. For a smaller size adult, you would want to use a 1-inch needle. For larger or obese patients, it may require up to a 3-inch needle to get past the fatty tissue into the muscle tissue. Next, you also want to make sure the patient is in the correct position, which is side-lying, with the side you plan on injecting face up. You do not want the patient to lie prone or face down. Having the patient lying prone leads to higher chances of injecting the needle into the sciatic nerve. Lastly, you want to make sure you find and correctly identify the anatomical landmarks on the patient prior to administering the injection. So in order to get a better visual of where the proper site is, as you can see in this diagram, you're going to want to divide the patient's buttock into 4 quadrants. The goal is to inject the medication into the upper lateral quadrant and not into any of the other quadrants, as the other 3 quadrants have a very high risk for hitting the sciatic nerve, as you can see in this diagram based off where the sciatic nerve runs through. In order to locate the ventrogluteal site, you're going to place the patient in a supine or lateral position on their side. Your right hand will be used for the patient's left hip, and your left hand will be used for the patient's right hip. You're going to place the heel or palm of your hand on the patient's greater trochanter with your thumb pointed inward toward the patient's belly button. You're going to then extend your index finger to the anterior superior iliac spine and spread your middle finger pointing towards the iliac crest. While pulling the skin tight, you're going to insert the needle into the V that's formed between your index and middle fingers. Okay, so before you guys break up into pairs, let's go over the handout that's in front of you. Please take this handout with you to your station and hand it to your clinical instructor. This is the procedure checklist that your clinical instructor is going to be using to critique your technique today. So let's go ahead and review the areas that you're going to be graded on. To clarify, for today's lesson, I want you guys to use the traditional intramuscular method. That is the chart and checklist that your instructor will be using to grade you, and not the Z-Track method. So for starters, your instructors are going to be watching to make sure you utilize the 6 rights of medication administration. Next, they want to see that you use the correct size syringe and needle, and as we discussed for the ventrogluteal site, it's going to be 1 to 3 inches. You're going to select the correct site, which today's lesson was on ventrogluteal site, and you're going to get checked off on that. So make sure you position your partner in that position we discussed on their side, with the side that they're getting the injection on facing up. So use the palm method to identify the greater trochanter and the iliac spine and the iliac crest with your hand, and once you found that V, you're going to make sure you use an alcohol prep pad to cleanse the area. So make sure you're using circular motions from the center of the site outwards. You're going to want to place an alcohol wipe on the patient's skin and use the alcohol wipe, the corner of it, to mark where you cleansed and where you're going to be injecting. Make sure you allow time for the alcohol wipe to dry before administering the medication. The clinical instructors are going to be watching you to make sure that you don correct PPE, so make sure you're putting on your gloves. Remove the cap. With the non-dominant hand, you're going to hold the skin tight by spreading the skin between your index and middle finger. You're going to hold the syringe between your thumb and fingers of your dominant hand like a pencil or a dart, and you're going to make sure you insert that needle at a 90-degree angle into the skin surface. Once you inject the needle fully, you're going to stabilize the syringe and you're going to aspirate back on the plunger, waiting for about 5 to 10 seconds and ensuring there's no blood in the syringe. If there is blood, you're going to stop, you're going to remove the needle, and you'll be instructed on how to proceed from there. If there is no blood, you're going to stabilize the syringe, you're going to use your thumb or your index finger of the dominant hand to press the plunger slowly to inject the medication. You're going at a rate about 5 to 10 seconds per ml. Lastly, you're going to go ahead and remove the needle along the line of insertion, and then you're going to engage the safety device. If the needle does not have a safety device, do not recap the needle, and make sure you place the needle in a proper sharps container or biohazard container, puncture-proof container. And that's what the clinical instructors will be watching you on. And then go ahead and apply a gauze pad or a Band-Aid as needed to your partner. Now, are there any questions with this checklist and what you guys are going to be graded on today? Great. Okay, so now's the time to put what you learned into practice. So go ahead and pair up with another student and go to a station. Make sure you take your handout with you for the checklist. The clinical instructors will be at each station to watch, critique, and evaluate your ventrogluteal injection technique. If you guys have any questions or concerns or need any clarification, please don't hesitate to ask any of the faculty.